The skill that I will be demonstrating is denture care. The equipment that I need for denture care is a face cloth, 2 towels, a disposable cup, toothlets, denture toothbrush, tongue depressor, Effordent cleansing tablet, and linen bag. I've washed my hands and gathered my supplies. Knock, knock. Hello. Hi, Mrs. Jones. How are you? Oh, I'm fine. Well, I'm Linda. I'm your CNA, and I thought I'd provide oral care and denture care, if that's okay. Oh, yes, that's fine. Awesome. Set down your barrier. And let's get it started. And wash my hands. How are you, Mrs. Smith? Oh, we're fine. Well, great. I'll be there to take care of your needs in just a minute. Closing my curtain. Closing my door. And checking my brakes. All right, Mrs. Jones, is it okay if I move your personal items out of the way? Oh, yeah, sure. And I also need to go into your drawer to get your equipment. Is that okay? Yeah. So I have dentures, Mrs. Basin, tongue depressor, lip balm, denture toothbrush, and denture toothpaste. And my toothlets I brought in, as well as my disposable cup. I'm just going to run and get some water, okay? Sure. And wet your washcloth. All right, I am back, Mrs. Jones. I want to apply half strength mouthwash. Raise up your bed to a comfortable working height. And because I'm kind of short, the only thing I will need to do is elevate your head of bed to at least 30 to 45 degrees. Sanitize my hands. Mrs. Jones, I'm going to put this barrier around you so we can keep your linen nice and clean and dry. Lifting up gently on your shoulders, I lay my barrier behind you. And I want most of the barrier to come out on my side since I'm going to be working on this side. And then just taking this edge and bringing it around. That way I can protect the pillow and your bed linen gown at the same time. All right, Mrs. Jones, would you mind handing me your dentures? Sure. Thank you very much. And now we're going to clean your mouth. Anytime we take dentures out of the mouth, we have to clean it. And before we put dentures into your mouth, we also have to clean your mouth. So I'm going to use a swab, a toothet. I dip it into the solution and squeeze the excess off on the side of the cup. This holds lots of fluid and we don't want you to aspirate on it. And then with my tongue depressor, I clean all surfaces. Cleaning your gums, cheeks, roof of your mouth. Throw this away and probably will need to use another one, depending on the resident. Squeeze off the excess and continue cleaning. Cleaning the gums, cheeks, roof of the mouth, tongue, cleaning everything. And throwing this away. Okay, Mrs. Jones, let's remove this basin and dump the mouthwash into the basin. The extra mouthwash. Wipe your mouth. Apply some lip balm. Okay, we're all done. So, removing your barrier by lifting up on your shoulders and putting this in my linen bag. Gloves off. Sanitize my hands. Alright, Mrs. Jones. Let's get you back into the body alignment. Call light within reach. And lower your head of bed. Okay. Wash my hands. Put my gloves on. And I'll be back when I brush your teeth, your dentures. Okay, so taking my ginger toothbrush, ginger toothpaste, and Emesis basin. Alright. And a paper towel to put on the back of the toilet as a barrier. I like to use two because I have so many supplies. Dump this into the toilet. Clean paper towel to turn on my faucet. And clean my equipment. Rinse. Dry. Place this onto my paper towel barrier. It's ready to receive the dentures when I am done. I will turn off the faucet and then put one barrier at the bottom of the sink, being careful not to touch the sink with my gloves. And now I can turn the faucet on. Cold water only, slow stream. This allows the sink to fill with water so that if I drop my dentures, there will be a shock absorber effect with the water in the sink. Rinse off my toothbrush and then put a pea-sized amount on both the tapered side and the flat surfaces of the toothbrush. I will put the toothpaste inside my Emesis basin. And now my teeth, if there were water here, I would just carefully hold on to the dentures, even with the cup, and pour it into the toilet. Now brushing my dentures. And then with the tapered end, I get into the grooves of the dentures, removing all the denture adhesive paste and any food that may have accumulated there. Rinsing and putting this right back in the denture cup. Now if the denture cup has gotten a little dirty, stained, then you can always get another one, but they're usually good for at least a week. So I'm brushing. Alright. Getting into the grooves with the tapered end of the toothbrush. Rinsing. Rinsing off my toothbrush. Putting everything into the Emesis basin. Fill this with cold water because when I get to the bedside, I'm going to put an Effordent tablet in here so that through the night, it can also be cleansing the dentures. Put this back into my Emesis basin. Keep everything secure. Remove the barrier while I am still dirty. Take off my gloves. Wash or sanitize my hands. Clean paper towel. Turn off the faucet. Pick up my barriers, flush the toilet, and return to the bedside. Okay, Mrs. Jones, I'm back. So I will put an Effordent tablet in the water where it will fizz up, cleaning the dentures overnight. In the morning, I will empty this out, brush the dentures as well before I return them to the resident's mouth. Putting my supplies back. Mrs. Jones, is there anything that I can do for you? No, I'm fine. You did a good job. Well, thank you. Put your personal belongings back. Your crawl light is within reach. You're in good body alignment. Covers are nice and neat. Opening up your curtains. There. Mrs. Smith, do you need anything? Okay. Well, I'll sanitize my hands. And I will see you ladies in 2 hours when I do my round.